My name is Emily Hickson. I'm a community health nurse in Des Moines, Iowa, and this is the proposal for my project, Sidewalks for Safe Exercise. The community that I'm working with is on the east side of Des Moines with Brubaker Elementary School and Hoyt Middle School at the center of the community, and it goes along East 42nd Street. The image on the right with the red outline, that's kind of the borders of the community for a visual representation. A little bit about the population. It's within Polk County, and to further narrow it down, because Polk County is pretty big, it's zip code 50317. Some of the social determinants of this community are race, sex, education level, and modes of transportation to work. Citydata.com was very helpful in providing information on this community. So the population is 1,676 people per square mile. The demographics, 80% white, 9.9% Latino, 4.6% black, and then out of that, 49% female and 51% male. Education level, 86.4% have a high school diploma, and 15.7% have a bachelor's degree or higher education. One statistic that I found really interesting was that 0.2% people ride their bike to work and 0.4% walk to work, which is really low. Polk County, Iowa Health Department provided information on the health of this community, and there's a high prevalence of coronary heart disease, diabetes, high blood pressure, and high cholesterol, and also that the community is physically inactive. When I did the windshield survey of this community, one thing that really stood out to me was the lack of sidewalks, and I'm going to demonstrate that here. In the middle, you can see Brubaker Elementary, and then I can take this little guy and show you just around the neighborhoods. You can see there's no sidewalks. And this is a really big barrier to exercise and getting physical activity. If you can't simply leave your home and go for a walk, that's a really big barrier if you have to go somewhere else for exercise. Or if you're exercising, it's really unsafe because you're exercising on the street. And this affects adults and it affects children, especially being so close to the school. So this really affects the whole community. So the age group is all ages. So the biggest health need for this community is the lack of access to safe exercise. And this correlates to some of the ailments that I mentioned earlier. So the physical inactivity, chronic diseases, low numbers of people walking or biking to work. Des Moines as a whole has 667 miles of sidewalk gaps, which they currently have a plan to create 180 miles of new sidewalk within the next 20 years, but unfortunately this community is not within that plan, which is why I'm doing this proposal. And not only is this a local issue, but a national issue as well. The Healthy People 2030, one of the leading health indicators is adults who meet current minimum guidelines for aerobic physical activity and muscle strengthening activity. The main goal of this project is that 50% of the community will have improved access to safe exercise by May 2026. The intervention that we'll be using is to increase neighborhood sidewalks by 60% by May 2026, and this will improve accessibility and safety for exercise. So that 60% is about 2 miles of new sidewalk, and the sidewalk construction location will be determined by priority and location to the schools, to busy streets, and to big gaps in sidewalks that are currently there. And I will be working with community members, contractors, and engineers to prioritize. The big question is, will this project be effective? And evidence shows in many studies that sidewalks in neighborhoods provide safety and mobility for physical activity. And people will walk for exercise if it is accessible. So like I said, if you can't walk outside your house and have a sidewalk to walk and exercise, you won't do it. And providing that accessibility increases exercise. To evaluate our success, a survey will be given before and after with categories measuring frequency of exercise, perceived safety level of exercise in the community, and access to exercise. and the project will be deemed successful if there's an increase in safe, accessible exercise from the baseline survey. And really here, the ultimate goal is to improve health of the community, and we'll be able to monitor trends in those chronic diseases. The timeline will start in May 2021 with the initial survey. And then summer 2021 to spring 2022, we'll collaborate that construction plan. May 2022, we'll begin the sidewalk construction. And then for the next 4 years, in the summer to fall, 25% will be done each year for 4 years in the actual construction and placing the sidewalks. And then May 2026, the project will be finalized, and May 2027, a year after that, that survey for measurement will go out. The overall budget for this project is $700,000. The community health nurse annual salary from that budget will be $15,000, so a total of $75,000. This won't be a full-time position for the nurse, so that's why it's just the $15,000. $400,000 of this budget will go to the collaborative team, so the construction workers and engineers, and then $225,000 will go to cost of raw materials like the cement and things for the construction. Here are the references that I used for this project. If you have any questions, you can direct them to me now. If not, thank you so much for listening. Stakeholders, I really hope that you think that this is an important project and will fund it for the future. Thank you so much.